And CLER is really, those site visitors are going to also want to know that you know what the national patient safety goals are. And these really don't change significantly from year to year, but these are the 2021 National Patient Safety Goals. And, it revolves around accurately identifying a patient to minimize any errors, improving staff communication, safety around medication administration, reducing harm from with regard to these clinical alarm systems, reducing the risk of healthcare-associated infections, which we see, and identifying patient safety risks within the hospital. So those are just a few, but please become familiar with these because you most likely will be asked about these national patient safety goals. And here's a kind of more specific drilled down safety goals about two forms of patient identification, reporting these critical results on a timely basis, how it comes into the electronic record and your response, labeling medications, reducing harm from anticoagulation therapy, preventing wrong patient, wrong site, and wrong procedures. These are also Joint Commission. These come out of Joint Commission in terms of these patient safety goals. So patient safety and how we've approached patient safety here at OSUMC, we have a number of modalities. Most of you may know that we do have an incident reporting system known as VERGE, and this is a risk management tool that the hospital uses to gather information on adverse incidents that have occurred anywhere in the hospital. And so we'll talk about that here shortly. We have had these safety event team meetings, which most recently have been more of a safety huddle, and that patient safety opportunity for resident and faculty involvement is evolving. So we'll have more information on that to come. Mortality and morbidity conferences. Prior to the pandemic, we had a very robust multidisciplinary mortality and morbidity conference in our auditorium. Since we haven't been able to aggregate in those large numbers to date, each of our departments and residencies should be conducting their own departmental mortality and morbidity conferences. And then health streams training. I know that we have all gone through health streams training on an annual basis. There are a number of modules that are focusing on patient safety. So that is also one of the ways we train our residents and fellows and faculty in patient safety. Many of the programs do have team care interdisciplinary rounds. So you may have, for example, PharmD or other disciplines rounding with you during the course of your inpatient rounds. And in some cases, you may have a little bit more expansive representation from other disciplines in your day-to-day team care rounds. And then we also have a clinical document improvement program, CDI. Faculty are well versed in this CDI program, and we often get information to quantify or clarify diagnoses for coding purposes. So how do I enter a risk management? We have a Ozone is our intranet for OSUMC. There's a lot of information there on a number of departments and activities. And if you go into Ozone and you click under departments, you'll have a drop-down box. And if you go down to quality management, there'll be another drop-down box, and you'll see this risk management incident reporting. If you click on that, it'll open up this box right here, and I'm going to expand that for you in this next slide. You will see a number of categories that where incidents can be reported. So perhaps you might have had an airway or anesthesia incident, adverse incident. You'd go ahead and click on this. It'll bring you through a number of boxes. What's great about this tool is it does not take long to actually enter an incident, possibly 2 to 5 minutes. That goes to our risk management and quality department. And these types of incidents are trended and tracked. And the goal here is to really look for system process failures or system process opportunities for improvement. And so you can see of the various types of incidents. You may have a patient that has developed a pulmonary embolus in the hospital or a deep vein thrombosis. There could be device or equipment failures. Patients, family members, visitors may fall. So there are slip and fall incidents that can be reported, laboratory issues, radiology issues. So we really do encourage our residents and fellows to be on the lookout for these adverse events and know that they have a personal opportunity to place these incidents in the reporting system so that they can be investigated. So why is CLER interested in this? Of course, it is a patient safety measure. They would like to know when they come here, they're going to ask, how many incidents are reported each year in your institution? And then how many of these are adverse events, so where something has gone wrong? And the majority of these across the country that are reported by staff and residents and faculty are adverse. But what we really need to get to is really identifying those areas where there are near misses or close calls, and how we enter those or how we recognize those as potential issues are important. And of course, the unsafe conditions. Reporting an unsafe condition that has the potential to do harm to a patient or staff or visitor is important. So they want to know the percentage of these incidents that are reported by staff, how many are reported by faculty, and percentage reported by residents. They really want to know this number. And what we're looking for internally is improvement year over year in the percentage of these incidents actually reported by our residents and fellows. So what is an adverse event? It's typically an injury, and it's rather than being caused by the underlying disease, it's caused by medical management, okay? It can prolong the hospitalization, or it can produce some kind of disability at the time of discharge, or likely both. Adverse events, by definition, are categorized into preventable and non-preventable. Those preventable adverse events are avoidable by any means currently available, okay? Those preventable adverse events are defined as care that has fallen below the standard of care expected for the community. So a near miss is essentially a close call or a good catch. Okay, so you might hear all of these terms when those site visitors come, and just so this is an event that might have resulted in harm, but the problem did not reach the patient. Okay, because typically in these cases there's a timely intervention. perhaps the patient was going down for a BKA, and somewhere along the line, the incorrect limb was targeted for the intervention, but somebody caught this error on the way down. Okay, so that's an example of a near miss or a close call, and a good catch. So an unsafe condition is any circumstance that increases the probability of a patient's safety event. So, and it could be anywhere in the environment. It may be medically related. It may be, an issue where there may be a spillage of bodily fluids in a patient room or down a hallway or coffee. All these can lead to slip and falls and patient safety events as well. And typically these unsafe conditions is not identifiable to a patient.